Mediators of inflammation. What is meant by mediators of inflammation? The mediators of inflammation are the substances that initiate and regulate inflammatory reactions. The most important mediators of acute inflammation are vasoactive amines, prostaglandins, leukotrienes, cytokines including chemokines, products of complement activation. Properties. Mediators are either secreted by cells or generated from plasma proteins. The major cells that produce mediators of acute inflammation are macrophages, dendritic cells and mast cells. Platelets, neutrophils, endothelial cells and most epithelia can also be induced to elaborate some of the mediators. Plasma-derived mediators are produced mostly in the liver and are present in the circulation as inactive precursors. Active mediators are produced only in response to various stimuli, microbial products and substances released from necrotic cells. Most of the mediators are short-lived. One mediator can stimulate the release of other mediator. Vasoactive amines, stored as preformed molecules in cells and therefore among the first mediators to be released during inflammation. Histamine, present in mast cells, basophils and platelets. Stored in mast cell granules and released by mast cell degranulation in response to a variety of stimuli, physical injury such as trauma, cold or heat. Binding of antibodies to mast cells, which underlies immediate hypersensitivity reactions. Anaphylotoxins C3A and C5A. Neuropeptides, substance P, cytokines, interleukin-1, interleukin-8. Histamine causes dilation of arterioles. Increased vascular permeability in venules, principal mediator of immediate transient phase contraction of some smooth muscles. Serotonin, 5-hydroxytryptamine, present in platelets and certain neuroendocrine cells. It is a neurotransmitter in the gut. Causes vasoconstriction during clotting. Cytokines and chemokines. Cytokines are proteins produced by many cell types that mediate and regulate immune and inflammatory reactions. Arachidonic acid metabolites. The lipid mediators prostaglandins and leukotrienes are produced from arachidonic acid present in membrane phospholipids and stimulates vascular and cellular reactions in acute inflammation. Lipoxins, generated by the lipoxygenase pathway, suppress inflammation by inhibiting recruitment of leukocytes. Prostaglandins, produced by mast cells, macrophages, endothelial cells and many other cell types. Generated by actions of two cyclooxygenases called COX-1 and COX-2. Actions of some important prostaglandins, PGE2, vasodilation, increases permeability of postcapillary venules, PGD2 chemotactant for neutrophils. PGI2 vasodilation, inhibits platelet aggregation. TXA2 vasoconstriction, promotes platelet aggregation.